Good evening and welcome, doctors. Our today's topic is hemolytic anemias. I'm going to explain it. It's very interesting topic, my dear friends. Let's start. Hemolytic anemias. Hemolytic, hemolytic anemia. So, my dear friends, what we understand here about hemolytic anemias, heme. Heme means blood, hemo means blood. Or we can say heme means RBCs. Here take RBC, not whole blood compound, but RBCs. Lytic means lysis. Lysis means breakdown of RBCs. Breakdown of RBCs pathologically due to some pathology here, due to some pathological breakdown of RBCs. So my dear friends, till here I hope you understand, but how here it's a breakdown of RBC by two ways. So remember, by two ways: by acquired Combs positive classification, and another one is hereditary Combs negative, my dear friends. So we are going to discuss separately so many topics about this. So firstly I am going to explain the acquired Combs positive anemia, but I am going to explain more things. What does it happen when RBC break down automatically, like some symptoms, and further we are going to identify some laboratorical data. So my dear friends, I am going to explain this. I am going to rub this one. I am going to rub, and then we are going to discuss separately the all anemias. Firstly, according to when RBC lysis done, it may be two types: intravascular lysis of RBC. Intravascular means inside the vessels, the lysis, the breakdown of RBC occurs more. That's why hemolysis and anemia. And extravascular. What does it mean? Indicate extravascular? It indicates like when breakdown of RBC in spleen or in liver. It is known as extravascular. So what kind of symptoms occur when the RBCs break down? You know how much the lifespan of RBC, RBC lifespan RBC means red blood cells, my dear friends. Where it is located, RBCs are located inside the hemoglobin, my dear friends. Red blood cells, 120 days. And what happens in hemolytic anemias? Here the lifespan of RBC is less because they break down earlier due to some pathologies. Okay, then laboratory data. What we are going to find in hemolytic anemia? Anemia like hyperbilirubinemia due to breakdown of RBCs earlier. What else? Here decrease heptaglobulin. Globulin decreases so many times they ask question what was decreases. And here we see jaundice also. Jaundice. Serum bilirubin increase in such cases. In all hemolytic anemias, such symptoms are occur, my dear friends. Hemosideruria, and there is increased red cell production. So what happened here? Reticulocytosis. These are the symptoms, my dear friends. And most of these hemolytic anemias we need to treat with folate or some corticosteroids. So I hope till here it's clear. It's an introduction. Now we are going for classification, and I am going to explain very easy, very simple way. Firstly, I am going to explain all the three hemolytic anemias which comes under comes positive acquired. They are mainly three types. Now see what kind of they are, like warm, autoimmune, A I am going to write, immune I, hemolytic anemia, warm, autoimmune hemolytic anemias, then cold, hemolytic anemia, autoimmune, same, then drug induced. These all three came under Combs positive acquired hemolytic anemias. My dear friends, in book when I read it take so much time, and it's difficult for to understand in a once reading. So I took more time and I decided to explain you in an easy way. So my dear friends, try to concentrate here. I'm going to make it very simple. In warm autoimmune hemolytic anemias, what happened? It's an autoimmune process. Autoimmune process in which autoantibodies destroy RBCs. How it destroy? It is often linked with I am writing by this way, short form, lymphoproliferative disease like CLL, chronic lymphocytic leukemia, and lymphomas. And what else here? Autosomal autoimmune diseases like here we see SLE, systemic lupus erythematosus. I already explained in my lecture, so see that lecture also. In that case also warm autoimmune hemolytic anemias can happen. Then scleroderma, and in case of rheumatoid arthritis, these are the autoimmune diseases. So my dear friends, in warm autoimmune hemolytic anemias, such definition we are going to see, and there is a lysis of RBC early destroyed. And in case of cold, what happens? Here also autoimmune, same process in which autoantibodies, till here it's similar, destroy RBCs. It related with I'm going to write this way, infection like mycoplasma, and viruses that cause cold autoimmune hemolytic anemia like HIV virus, Epstein-Barr virus, which is also known as mononucleosis, and it causes the early destroy of RBCs. So another one, drug induced, also the same process, but in drug induced the lysis of RBC occurs earlier. What kind of drugs? Like most common drug which cause the autoimmune hemolytic anemia is cephalosporin. My dear friends, cephalosporin group like ceftriaxone, cefaxime, cefepime. I am going to use these drugs, antibiotics. Very common because very excellent result. But some antibiotics more also like. But I haven't seen autoimmune hemolytic anemias because the chances of autoimmune hemolytic anemias or cephalosporin user are less, not so much, but this include more causes. If you see autoimmune hemolytic anemias, immediately stop cephalosporin. Okay, like other antibiotics, like in case of UTI, in case of prostatitis, we are going to use levofloxacin. Very good, very excellent antibiotic, 500 mg once daily. Okay, oral dose. 500 mg IV also, preparation only OD. It causes autoimmune hemolytic anemias, and another one also that causes autoimmune hemolytic anemias like rifampin, nitrofurantoin. The dose is 100 mg. So no need to remember doses here. Only remember the drugs which causes the autoimmune hemolytic anemias. If you find such anemias, immediately stop these drugs and start the folate supplement. Okay, nitrofurantoin. And here it's autoimmune process, so prednisolone also we can use sometime. Yes, in nitrofurantoin, these are the drugs: rifampin, dapsone. These drugs we are going to use because these are the drug in use, my dear friends. And carbidopa, levodopa, where we are going to use in Parkinsonism, my dear friends. Carbidopa, levodopa, alpha-methyl dopa, where we are going to use alpha-methyl dopa in pregnancy-induced hypertension. This one is a drug of choice. So these are the drugs. And what are the symptoms? I already explained. All hemolytic anemias, similar symptoms. All laboratory data are same. In hemolytic anemias, I already explained what is hemolytic anemia. I already explained. Comes positive acquired. All the three definitions are very much clear for you. And we see direct DAT. What is it? DAT is known as Combs test. So here the DAT is positive or negative. Dr. Emily, please answer. Yes, he is absolutely right and brilliant answer. He is really very actively participating, coming after so many days. Okay, direct antiglobulin test. Then another test like cold agglutinin test. This is negative, my dear friends. This cold agglutinin test is negative because this is warm autoimmune hemolytic anemias. Here the temperature is for warm, it causes is more than 37 degrees Celsius need to cause warm autoimmune hemolytic anemias. And how to treat? My question goes to Dr. Lausin. Please answer. How to treat? I hope he can't. Then Dr. Emily, please answer. How to treat this autoimmune hemolytic anemia? Yes, he is brilliant. And folic acid, folate. Remember, Dr. Lausin, folate. We can use this anemia, folate and prednisolone. Brilliant. Prednisolone we are going to use. It is corticosteroid. Why we are going to use this prednisolone? He is absolutely right because it's autoantibodies procedure. That's why there are two autoantibodies, IgM and IgG. In case of IgM, there is a lysis of RBCs in liver and Kupffer cell. But in case of IgG, there is a lysis of RBCs in spleen. So in some anemias, we are going to do splenectomy also, but not here. We can use transfusion also in warm autoimmune hemolytic anemias, but rarely severely indicated. Then otherwise, folate and prednisolone is sufficient, more than enough. Okay, here comes positive. Yeah, so DAT test also positive here, and my cold agglutinin test is positive or negative. Dr. Emily, please answer.
Positive.
Yes, again he is right, but in cold autoimmune hemolytic anemias it is positive. And temperature must be 0 to 4 degrees Celsius. It causes when, what was the treatment? Treatment not in exposure of cold. In case of cold, I saw already such patient when I am in abroad. I saw so many patients, they are wearing gloves. Their temperature is minus 40 and minus 30 there. That's why I saw that patients, their extremities are yellow, not yellow, it's blue, cyanosis, because when they are come in contact with a cold, the autoantibodies develop and break down the RBCs, and it causes cyanosis, purple color of arms and knees, also not knees, foot. So they are wearing socks, and so stop exposure of cold stop exposure, like wearing gloves, okay, shoes, better shoes, and prednisolone here. And what was the drug induced? To stop the drug treatment. treatment comes positive, DAT, direct agglutinin test is positive, stop the drug immediately and prednisolone immediately. So my dear friends, comes positive anemia, it's clear for you. All examination in USMLE and any examination, they are going to ask these questions from this also. Nothing new they are going to ask, nothing new, because they don't have nothing to ask from this. From this, only these questions. Mostly you see your books, and if you study thoroughly, you can try to solve it, and you are easily solve answers. So now our last remain. There is Coombs negative acquired hemolytic anemia, where the Coombs test is negative. Do you remember indirect Coombs test? I already explained in RS negative pregnancy. So see that video also, that will helpful for you. But now we are going to discuss here Coombs negative hemolytic anemias. Here include mainly 4 types, but third one, sickle cell anemia, I am going to explain in my another video that take another topic, because I am going to explain very thoroughly that topic, very good. Now there I am going to explain the topic like G6PD deficiency, G6PD deficiency anemia. Okay, my dear friends, PNH, paroxysmal nocturnal hemoglobinuria, and hereditary spherocytosis, HS I am going to write. So see how to differentiate these anemias. It's very simple and very logical to explain. Firstly, I am going to explain G6PD. It is X-linked recessive. Firstly, X-linked recessive, XLR I am going to write here. And here is the deficiency of enzyme G6PD. It means glucose 6-pyrophosphate dehydrogenase enzyme deficiency. So my dear friends, what does it happen if this deficiency occurs? There is a result in reduction of which result in reduction of antioxidant like NADPH, and which causes the lysis of RBCs. And PNH, paroxysmal nocturnal hemoglobinuria, it's an idiopathic condition. Idiopathic means nobody knows the cause. And here clonal defect in RBC membrane, clonal defect in RBC membrane in this case. And what else happen? There GPI protein, in GPI protein, and there is increased complement. And what does it complement? When it is idiopathic, but clonal defect in RBC membrane, GPI protein, which increase the complement system. And what does it happen? Why it is called paroxysmal nocturnal hemoglobinuria? Because the night time this complement increases due to the deficiency in membrane of GPI protein, and during night time they happens more, so lysis of RBC more. When they wake up, we see cola color urine. Coca-Cola have you already drunk? But no need to drink. Oh sorry, I am joking. It's cola color urine. When we will wake up, that time PNH, because there the frequency of lysis of RBC is more during night in GPI protein. My dear friends, it's very clear for you, I hope so. And what else? And we see, okay, till here I hope it's clear. And next, hereditary spherocytosis. What does it happen there? In this, what happens? There is a membrane protein defect of RBCs. Spectrin is absent here. That's why what happens? Spherocytes, RBC spherocyte shape occurs in case of hereditary spherocytosis. And when there is spectrin is absent, the RBC flexibility loses and stability it loses. That's why the lysis occur. I hope here it's very clear. And laboratory investigation I'm going to explain. In G6 and hereditary spherocytosis is autosomal dominant, but PNH is nothing. G6PD is X-linked recessive. Here the deficiency of G6PD result in reduction of antioxidant like NADPH. And what happens next, I'm going to explain how to diagnose this G6PD. In G6PD we see on blood serum pathology like bite cells occurs. Bite cells or hinge bodies we see here. So my dear friends, hinge bodies, that is purple spot of RBC. Purple spot of RBCs. So I hope till here it's clear. And what else it causes G6PD, like nitrofurantoin, sulfur drug, dapsone, and foamines. Also, so see that drugs also, if they cause such a G6PD deficiency, and to treatment is stop that drug and hydration. And now we are going to discuss about PNH, how to diagnose. Here we see urine analysis, hemoglobinuria, and what happens, anti-acidified serum lysis, hem test we see here, hem test we saw here. So this must be the positive, and urine hemoglobinuria increases. And T color, cola color urine here increase risk of coagulation. That's why anticoagulant we can use. Treatment here, iron, folate we can use, and anticoagulant also, because here the coagulation risk maybe increases. So PNH, I hope it's clear for you. And hereditary spherocytosis, laboratory data smear, we see spherocytes, on smear. And initial test we are going to use is osmotic fragility test. Here comes negative in all these three. And folate we are going to use. Here is splenomegaly, because these spherocyte cells are breakdown in the spleen, so splenomegaly, and treatment is folate or by splenectomy. So my dear friends, I hope till here it's very much clear for you. Firstly, we already learned autoimmune warm hemolytic anemias, cold autoimmune hemolytic anemias, and drug induced. And here we learned Combs negative, that is hereditary one, hemolytic anemia. Here we see G6PD deficiency. G6PD deficiency, what happens? There is a deficiency of G6PD enzyme which causes the antioxidant deficiency like NADPH, and which causes the hemolysis. It causes the hemolysis. And what else? Hereditary spherocytosis. Hereditary spherocytosis includes there the by birth congenital defect like autosomal dominant one. This is, and there the spherocyte cells are occurs. And what does it happen? Spectrin deficiency, and which causes the flexibility and stability, loses the RBC, and that's why has spherocytes. And these are breakdown in the spleen. So spherocytes we see in hereditary spherocytosis, treatment is splenectomy, because spleen is splenomegaly, that's fine. And folate we can use here. And another one, PNH, paroxysmal nocturnal hemoglobinuria. What does we see here? It is idiopathic but defect in RBC like GPI protein, and which increases the complement level, and this complement level increases when we are going to sleep, and these complement increases due to GPI deficiency, and it causes the hemolysis in our RBCs. This is the intravascular hemolysis. So in vessels, so we are going to use iron and folate also. So my dear, hem test and cola color urine is positive, acidified here, bite cell, his body so many times, so many times in any examination they are going to ask repeatedly such questions. And osmotic fragility test like hereditary spherocytosis, this is autosomal dominant, such questions they like to ask so many times, my dear friends. So please try and understand. I already made this summary in so simple way. If you have any questions, any doubts, so please ask me. I am thankful for all doctors, those who are attending my lecture. and giving their precious time to me to listen. And I am going to ask the online viewers who are watching me online, please, if you still not subscribe my channel, please don't forget to subscribe my channel. And if you like, please put like on my videos. And if you have any query, any questions regarding these topics, you can ask me. I am ready to answer. Thank you my dear friends. Thank you. Have a good day, nice day. Thanks.